Hello, I'm Shirley Hickman, Executive Director and founding member of Threads of Life, a national organization with a mission to support family members living with the outcome of workplace tragedies, as defined as life-altering injuries, occupational diseases, or death. Family members whose lives have been forever changed as a result of a member going to work and not coming home healthy, or not at all. I'm the mother of Tim Hickman, our 20-year-old son, who went to work on March the 23rd, 1996, and never came home. Our family entered a world we did not understand nor comprehend. In some ways, those feelings of not understanding and not comprehending are similar to the past several weeks, as employers and employees have had to learn new ways to maintain their work. We also pause today to give thanks to all those who work on the front lines, the medical staff, the first responders, police, fire, ambulance, those who ensure we have all the essential supplies, the truck drivers, those in the food industry. All of us have had to cope with daily changes. These are very significant and cause anxiety in many people. The world we knew before will never be the same. The anxiety-provoking emotions that many people are currently dealing with as a result of COVID-19 are very similar to the instant impact a family faces when they get the tragic news. Our family knows this firsthand. Tim worked part-time at a local arena and attended college full-time. He enjoyed spending his time with friends, whether they gathered to play sports, go camping, or meet in a local bar. He was known by his employer and the staff at college that he had a special gift of working with individuals with physical and mental challenges. Working in an arena was a good fit for Tim with his love of hockey. Outside of work, he was often picked up as a goalie by a team that didn't have one. Tim was our second child. His brother Michael once shared that what he would miss most is the 50 years he didn't have. It took me a long time before I could make popcorn. Our family was also home to several foster children, and popcorn had become my stress food. The boys would have their own bowl to share, and I would have my own. Tim would often come home from school and pop a bag into the microwave, and he would overcook it, perhaps even burn it. Finally, one day I said to myself, okay, I just have to get over this. Let's make popcorn. And I have not got over Tim's death. But each bowl of popcorn gives me an opportunity to reflect on the times that we shared with Tim. Like the time I went into his room and I found the turtle was dead. When he came home from school, I shared the sad news with Tim. His response was, "Yes, I know. It died a few days ago." Did I laugh at the time? Likely not. But now I can. March the 23rd. One phone call changed our lives forever. There's been an explosion at Silverwood's Arena. We didn't know how bad Tim was injured, but he was on his way to the hospital. And the next 10 days, while Tim was on life support, we kept hearing the same message from the doctor. Tim is breathing, one breath at a time. Let's hope. That breath, that hope, ended on April the 2nd. Our family was very fortunate. We were surrounded by family, friends, neighbors, and our church community. All the caring people from the community organizations and teams that we had been connected to. Our physical needs were met. We have our faith, but we were lost. We couldn't console each other. We couldn't fix this. My husband spent his grief hours in the garage, talking to the dog, while building something or trying to fix something. Michael had his group of friends, but none of these young people had the experience of grief or dealing with the death of a sibling. We walked alone. Some months later, still in the early days of our grief journey, I realized that what I wanted was to understand what had happened. What was the cause? How could it have been prevented? Throughout my lifetime, I was always finding myself in a situation to care for others, and therefore it was likely no coincidence that the Crown Attorney asked me to reach out to a widow who had asked to be connected. One by one, family members started to be connected, and the health and safety associations, the unions, the ministries of labour, the workers' compensation boards in Canada all saw the value in family members being connected through a community of support. On a traditional day of mourning, many organizations would have been hosting an event to bring their employees, the unions, the public together to honor the lives of Canadian workers and their families, lives forever changed by a workplace tragedy. April the 28th is a day to pause, to reflect on these lives. One is too many. Each life has a ripple effect to immediate family, extended family, to the co-workers, to the first responders, to the medical staff at hospitals. Each life leaves a legacy. At Threads of Life, we host an annual event each year called a Family Forum. It's an opportunity for family members to come together to learn healthy coping skills, to share what works with others, and to know that they are not alone. They create a new community of support. We start each of these events with a reflection on our mission and vision and the lighting of a candle. As I light this candle, I invite each of you to reflect on our mission statement. Our mission is to help families heal through a community of support and promote the elimination of life-altering workplace injuries, illnesses, and deaths. The first candle was lit in 2004 at Volunteer Family Guide training. Volunteer Family Guides are trained to provide peer support to other family members. They provide a listening ear to each other or to new families. New families are so grateful to have the opportunity to have someone who may understand the grief journey, the investigations, the legal system, how to handle anniversaries. We also share with all of you and many of your organizations one common vision. Threads of Life will lead and inspire a culture shift, as a result of which work-related injuries, illnesses, and deaths are morally, socially, and economically unacceptable. We would then light a candle for each stream of our Threads of Life family members. We all reflect on the lives of those living with life-altering injury, with occupational disease, and with the outcome of a fatal injury. We would then invite each family to come forward and bring a photo of their loved one and place a candle in front of it and light that candle. As you can see, it's a very powerful image that we come together as a community of support. The reflection ceremony is an opportunity to reflect with love for our family member, a moment to honor lives that have been lost, future dreams, possibilities, and hope for the future for ourselves, our family, and those we love. We are aware that each day in Canada, 3 families will receive the devastating news that the family member that they knew, life has been forever changed. We stand together today to pause, to reflect, to honor, and give thanks to each worker in Canada who didn't come home as a result of a workplace incident. To each family, employer, co-worker who has been forever changed by one of these tragedies, please take the time to mourn and give thanks for the time you shared. I look forward to next year when we can gather publicly to acknowledge as a community these workers and their families. I am very aware that everyone in Canada is dealing with the health and safety concerns of COVID-19. Once this crisis passes, I trust the health and safety professionals and everyone involved with health and safety will reflect on what we have learned about how we work together to create safe workplaces for all workers. I invite you now to light your own candle and take a moment of silence to reflect.